Trauma to the head, horrible. Those rocks look heavy. She got nailed twice, it looks like. One knocked her down, another one just like crushed her. You even see the blood. Getting destroyed by the claw of a bear. Those things are huge and massive, and the amount of weight behind it, it's gonna lacerate you, no problem. Oh, okay. That's a nasty impalement. Holy cow. Hey everyone, Dr. Jordan Wagner here, board certified emergency medicine physician. Today we're going to check out the game Rise of the Tomb Raider. We're going to see some gnarly injuries with Lara Croft, so let's get into it.
Something isn't right.
Oh, don't fall off the cliff. Oh, dead driver. Nice flip. Let's see what happens. Definitely going to be shaken up, and obviously not wearing a seatbelt. You're probably going to be a lot more banged up. Oh my gosh. This car flipping, you're gonna have a lot more damage potential to yourself, especially if you're not wearing a seatbelt. So obviously, we all have to wear seatbelts and we don't like to because it's uncomfortable, but it saves lives and prevents you from flipping around. You know how many times I've seen a patient come to the emergency department where EMS tells me that the patient was found thrown from their vehicle because they weren't wearing their seatbelt 50 to 100 yards away from the accident. When somebody's tumbling and flipping, one, you're getting smashed internally by the car, and then however fast the car is going, you potentially have that projectile of yourself. Should be a lot of, unfortunately, broken bones, injuries, lacerations, all the windows popping out. Obviously this car is pretty solid and steel, but there potentially could be a lot more damage in real life. So be careful. And in this car too, this vehicle, they didn't have airbags, which again, pad you when you're bouncing around like crazy, but usually that only goes off with frontal impact too. Injuries are pretty intense. And then all of a sudden, this poor woman, her freaking car explodes and she gets shot down a rock slide, and now she's sliding where she's wearing a tank top down jagged rock. She somehow has a pickaxe or a climbing axe with her, and she's able to hold on. But that amount of sliding, you're going to get some what we call road rash or abrasions, potentially lacerations. And then the drop, she's landed on a hard force. It's hard to tell exactly how far that she dropped onto her body, which can cause compressive injuries, rib fractures, vertebral fractures, compression fractures. And obviously if you land on an ankle, it can snap. Same with an outstretched arm. Basically if you fall, you want to hit and tumble so you can take out the force. There we go. Perfect segue. Be careful.
Can you make it across?
I can make it.
Oh, don't do it. Ooh, tied to each other. Okay.
Don't think I can make that jump.
Stay there. I'll anchor a line for you at the top.
All right, I'll give you some slack.
That looks like a pretty dangerous situation. She's pretty good at it.
Almost there, Lara. You got it.
I guess it is Lara Croft. I mean, the mechanics of that jump is probably impossible. That would take a lot of force to be able to get up there, but it was really cool.
Jonah.
Oh, he made it off somehow. Uh-oh. Oh no. There goes Laura and Jonah. Oh! Okay. Right there, that compressive force and fall down. Typically, falls greater than 15 feet or 3 times our height can cause serious amount of damage. She nailed the side of her body right into that rock. Basically, rib fractures, pelvic fractures. You can have splenic injury, liver injuries, internal bleeding, all of those things when you compress down. We don't bend that easily, so you can cause a lot of damage. Obviously, she's okay. She's okay. She's got not even the injuries, bumps and bruises or contusions or swelling, anything, which is what normally would happen. And now she's got to fight off an avalanche.
Go back, Jonah. Get the shelter.
There we go. Even that type of sliding power, when she grips into the ice and it stops, you can dislocate your shoulder, tear a bunch of ligaments, tendons, rip a bunch of muscles. It might not happen, but that's a lot of force and it could. The most common type of dislocation ends up being an anterior shoulder dislocation, where the head of the shoulder actually goes into the front. Something super common that we end up seeing. And we can just put it back in the emergency department, sometimes with just a little bit of lidocaine, no medications, or we sedate you so you don't feel anything, we put it back in. And now it just looks like she fell pretty darn far. So if you fall directly, say, on your feet, your injuries can lead from calcaneal fractures, which is your heel, all the way up. So when we have somebody who, say, falls off a roof and they land on their feet and they complain of pain, we literally do x-rays all the way up because the compressive force can go through their legs all the way up into their spine and cause spinal compression fractures as well. And then obviously you can snap any of the bones, the tibia, the fibula, the femur, all depends on how you land. This character, Lara Croft, she seems to injure herself all over the place and probably her whole life, right? So you're breaking bones, you're healing them. Typically when you break a bone and you allow it to heal its natural period of time, that area actually calcifies harder and stronger. But then at that point too, if you continue to cause more trauma, more injuries without allowing it to heal, it's easy for it to snap again in that same area. But then you also have to think, okay, now that bone is harder in one area, now there's another area that might be more weak. Once your body starts getting kind of too brittle with all the injuries, you're probably more apt to get more and more injuries in the future. All right, now she's grasping for air because she's in this frozen tundra over here. She's gonna get hypothermic if she doesn't get shelter and stay out in this cold weather. Hypothermia, there's multiple different levels of it, right? So you have multiple stages depending on what your core temperature ends up being. So she's shivering and shaking at the moment. So she's like in the what we call mild hypothermia, basically where your temperature is around 32 to 34 degrees Celsius, which Fahrenheit, that's around like 90 to 95 degrees Fahrenheit. You're shivering, so your body's trying to make heat, which she's trying to do. You're typically gonna be tachycardic and hypertensive because your adrenaline is kicking in too to be able to help survive. But if you end up staying out there longer, you go into the next phase where it's like moderate, and actually the death rate, somebody in moderate hypothermia is around 20% if you don't get treatment. Basically, that's when your temperature goes between like 32 to 28 degrees Celsius. And at that point, shivering actually starts to almost dwindle to stop. And then your body starts shutting down. And then you get confused, you become ataxic, basically when you're having trouble walking, you're kind of off, you almost look drunk, you're not thinking clearly, and then at that point, when you're not thinking clearly, now you're not going to get into shelter and those sorts of things. So if you get hypothermic, you need to seek shelter early, because if you don't get there soon enough, your brain's not going to tell you later. And then when you get into even severe hypothermia, temperatures going below 28 degrees, you're high risk of death, closer to almost 50%, about 40%. Different things occur. So body's shutting down, bradycardia, slow heart rate, hypotension, low blood pressure. You're not shivering. Your blood vessels then actually redilate because your body gets really confused. So at first you vasoconstrict. Basically, what does that mean? You shunt blood to your core vital organs, so your heart, your lungs, and your brain, to preserve them. But once your system kind of gets jacked up and it gets confused, basically, because now you're so cold, things can kind of cause issues and the distribution of blood gets very, very off. So then what's really interesting, you're typically going to potentially die from cardiac arrest due to your heart going into funny rhythms. It's eventually going to stop. Typically you go into what's called ventricular tachycardia or ventricular fibrillation, where the heart's just quivering and then you die. A lot of times we'll get patients who have hypothermic injuries or who are hypothermic. I'm going to say this, it's kind of messed up to say, but if somebody's in cardiac arrest, one of the things that we say is they're not dead till they're warm and dead. So what happens, what do I mean by that? So if somebody is super cold and their temperature is below the normal, below 32. One, you potentially not going to feel a pulse. They're vasoconstricted and they're shunting all their blood to their core. The other thing is the processes of the body are slowing down. So it could be protective of the brain, only because nowadays, say somebody has a cardiac arrest and we get them back, we actually cool them down. It's called therapeutic hypothermia, basically because we know it's neuroprotective or protects your brain. But what ends up happening is the normal medications that we would use, adrenaline, to try to help this individual won't work when their temperature is that cold. And same with shocking. When we want to defibrillate somebody or shock them, it won't work until their bodies are more warm. You continue to do CPR until you're basically able to get the body warmed, and then you do your normal CPR and resuscitation that you would need. Oh, what the heck is that? Oh, okay. That's a nasty impalement. Holy cow. Let's unpackage that for a second. One, she gets trapped in the foot. I don't know if that was a bear trap or just a cufflink type trap to her ankle, but it held her in place, and then a massive spike hit her in the abdomen. The massive spike into the abdomen will kill you if it hits the perfect spot. So what do I mean by that? There's a lot of injuries that occur here. So you're hitting right down the middle. Obviously, we all know our spine and our spinal cords go right down the middle. So if that gets severed at the level where she's at, probably T10, then you're going to be paralyzed from the waist down. Okay, it won't necessarily kill you right away. Then all the other structures in the way. Your aorta. If you rupture that and slice it right open, you don't have much time left. We have it even when people have what's called a AAA, which is basically an abdominal aortic aneurysm, where if that pops, same as if it gets destroyed by a spike, your body's just gonna bleed out all the pints of blood that you have in your body, anywhere from 6 to 8 pints, depending on how big you are, and you're just gonna bleed out and die pretty instantaneously because you're not pumping any blood anywhere to your brain. You'll pass out, and nothing to your heart, and it'll just stop. Pretty realistic in that standpoint. And then you have your intestines, your stomach, you have a lot of different organs in the way. A lot of times if those get injured, you can last a long time as long as the bleeding isn't so intense that you just bleed out and die. But that was pretty intense, and obviously she died right away. Okay, smart. Oh no. So now she's underwater and she's got to not drown. That's pretty good. So freedivers can hold their breath. I think some of the records are above 10 minutes, but they're calm and relaxed and they're not fighting. But when you get in that situation, we panic a lot. You can even drown in a bucket of water. Sadly, children can fall and flip into a bucket of water and they drown because they can't get themselves out. But drowning injuries, you won't typically die as fast as in this video game, but it's a huge process that goes in our body. Basically, when you drown and you get submerged underwater, there's different reflexes that occur. What kills you is that you're hypoxic, right? You're not getting any oxygen to your tissues, your brain, your heart, and then you die. What ends up happening, people were like, oh, I swallow so much water, blah, blah, blah. You actually don't swallow that much water. You only need a little bit of water to get in the way of what's called your alveoli and wash out what's called your surfactant. The surfactant is a chemical that our bodies make that keep our alveoli, which are these little air sacs, it keeps them open. So it keeps what's called surface tension to allow air and gas exchange to occur. If you lose that, they collapse and then you can't get any oxygen exchange with your blood. So no matter what you're breathing, you're not exchanging. And then you can't breathe through water, right? So gas exchange can't occur if there's water in the way. And then what ends up happening, first you become tachycardic and hypertensive, and then all of a sudden you become hypotensive, bradycardic, you get confused, you get brain swelling, your heart tissue, you're gonna have a heart attack and you're gonna go into cardiac arrest. Usually it occurs in cold water, right? So now you have the hypothermic component of it as well. They actually even say there's a better survival if you get submerged in cold water than with warm water, because what happens is when you get hypothermic, the processes in your body slow down. So you're not expending as much potential energy and your cells can last longer. So if you're able to cool yourself on the inside as well as the outside, you will do better. So there's been cases in the past where people have drowned and they've been dead, so to speak, for like an hour and a half or 70 something minutes. And then once they get resuscitated and revived, no problems with their mentation and they're back to live a normal life because they got so cold so fast, and then we were able to rewarm them and there was no permanent damage. Oh, ground's about to drop. Okay, she made it. Oh man, who went backwards? So you see this in video games all over the place, even in movies, Indiana Jones, all the stuff I watched as a kid. Someone falls on spikes. You fall on spikes like that, you're getting impaled. Depending on what organ is injured, you're potentially gonna die pretty fast, right? You get impaled into your lungs. As long as you miss a major vessel, you're gonna cause some bleeding in the lung, but you can have a collapsed lung, that sort of thing. But you can survive if you can get off the impaled object. That's the other problem. And same thing is, is it gonna hit your heart? Is it gonna hit your aorta? Is it gonna hit into your neck, to your brain? Pretty much if you're gonna get multiple impalements and you don't hit anything major, one, you're gonna be stuck there and you're gonna live a lot longer than you really want to. And hopefully your adrenaline and your altered mental status because of the euphoria of your own chemicals in your body causes you not to feel pain, because that looks excruciating and probably doesn't feel really well. Uh-oh. Oh! Okay, trauma to the head, horrible. We see it all the time. Those rocks look heavy. She got nailed twice, it looks like. One knocked her down, another one just like crushed her. You even see the blood. Traumatic brain injury occurs so often. That stance, one, you're getting the gravity, the weight of it. You're gonna cause skull fracture. You're gonna cause bleeding in your head. Most of the time what happens is you're gonna have all different type of bleeding. You can have bleeding into brain tissue, causing intraparenchymal bleeding. You can have a subdural hematoma. You can have an epidural hematoma and a subarachnoid bleed. All different things. You can even have your skull fracture open and your brain just gets smushed all over the place, which occurs. You get cracked on the top of the head, your neck's gonna bobble around and you can snap a neck, and if you snap it too high, again, that's not compatible with life because you can't breathe. Multiple ways that you're gonna die, potentially getting crushed on the top of your head like that. Don't want that bear coming after me. You're screwed. Dodge the attack. Nope. Oh, getting destroyed by the claw of a bear. Those things are huge and massive, and the amount of weight behind it, it's gonna lacerate you, no problem. And then getting destroyed by getting bitten by this bear, like, you have no chance. So what ends up happening is you're gonna get lacerations to your skin, but it potentially won't be deep enough. It could, but you'll probably fracture something because of the force. And then obviously if the bear is just ripping through your head, you have no chance of survival. But major vessels in your neck, because they're going for your neck, and a lot of crush injuries to your skull and to your face can occur with these. Hopefully nobody ever gets to experience being mauled by a bear. It happens, but would not want to die that way. You're potentially not going to die instantaneously. You're going to suffer through that kind of pain. And then if you don't die and you have all these wounds, now you have potentially infected wounds. You got animal bites that have bacteria that you need antibiotics for, and then even the open lacerations from the bear claws, you need to cover up and make sure that they don't get infected too.
I left you in charge here.
Yes, sir. But we didn't expect such heavy resistance.
You were to be my eyes. I expected you to see.
Uh-oh.
You must know what is at stake with this operation.
Yes, but no. No.
You don't.
No.
How could someone like you?
Oh, was he squishing out his eyeballs? Holy cow. First off, just looking at this, I don't know if I would hold the guy's shoulders if my eyeballs are getting crushed. I would try to get away. But besides that, could this actually occur? Yeah, if there's enough force, you can definitely poke an eye out. You can squish an eye. There's a fibrous layer around the eyeballs that you do have to penetrate to kind of squish the fluid out. So there's two different types of fluid in our eyeballs. There's aqueous humor and then there's vitreous humor. The vitreous is basically the more liquid in our eyeballs. If you actually lose that, it's so specific to the eye that there's really not a good substitute. So you can actually fill it back up with fluid if you're able to get to a doctor to see if you can get the vision back in the eye, but it doesn't happen too often because you have on the back of the eyes the retina, which is what helps everybody see, and then your blood vessels back there and the optic nerve as well. So basically the sphere of the eye itself is mostly fluid. You have some intricate structures in the front of the eye, and the eyeballs are very, very specialized organ. That's why we have two different types of doctors. We have the optometrist and then the eye surgeon, which is the ophthalmologist. Anytime I even get a crazy case in the emergency department, I call the ophthalmologist because the eyes are so important to us as humans, one of our senses, right? That type of trauma to the eye is unlikely that he's going to get any medical care pretty fast, and he's probably going to be without vision the rest of his life. Uh-oh. Why would you sneak up on a wolf? He's got bit in the leg and getting destroyed. Oof. Trying to use her arm to block her. Okay, went right to the neck, to the jugular. We know major vessels flying in your neck. You got your carotid artery and your jugular vein on both sides. They're big hoses basically coming off. Well, the arteries are coming off the heart. If you get that lacerated, it's going to pump pretty fast and you can die pretty fast if you don't have good control of it. Got bit on the leg. Basically, dogs cause compressive force, so you can break the bone or puncture the bone. And if that doesn't get treated, if you don't die, you can get eventually something called osteomyelitis, which is basically infection of the bone. So that takes antibiotics, months to be able to get in there, that you need treated every day. And then obviously she's using her arm to try to defend her, which is smart, but unfortunately got to the neck and was able to bite her and rip it open and cause death. Obviously it doesn't occur that fast. You got wolves, you got to be careful of like infections. Molotov cocktail gone bad. Oh my gosh. She died most likely because of asphyxiation. Fire consumed all the oxygen around her and she couldn't breathe. And then can even inhale the flames burning your airway, which then can cause swelling and then blocking your airway. The skin burns, so first degree, second degree, third degree, won't kill you right away. It's more of an airway, a lack of breathing issue when it comes to that type of fire or burns. And the thing we always look for when somebody comes to the ER is if they have soot or burned nasal hairs or soot and darkness in the back of their throat, because then that means they inhaled the fire, which now we know there's a high chance of that upper airway being occluded, meaning so much swelling that you're not going to be able to get any air through that area, and then basically you're going to die if you don't have a tube in your throat or a hole in your neck that we have to emergently make. So what we'll end up doing is intubate, which is to put the plastic tube into your airways and put you on a ventilator. That way you could swell around the tube and not die, so we can have a way to breathe for you until the swelling goes away. It's pretty scary. Holy big lynx. Look at those teeth. Oh, okay. Again, just like the previous animal attacks, this is a huge cat, which mauled her and then destroyed her neck. So that amount of force can snap a neck. So if you have C1 or C2 fractured, nails out the spinal cord, you're gonna stop breathing and die pretty instantaneously. And then open up blood vessels, you're gonna die, and lacerations. Now, interesting with cats, we've all heard of cat scratch fever. So cats, their claws, because they clean themselves so much and they're licking with their mouths, they have bacteria. So you have a high risk of getting infection. And actually, those type of infections spread pretty fast. So needs immediate medical attention if that occurs and to get on antibiotics. And also with cats, he or she, that big cat, had huge big canines on top and bottom, but there are smaller ones. And a lot of times the smaller ones can puncture and then put the bacteria and infection deeper, which makes it harder to clean, and then you can get pretty infected really easily. Direct shot right through the back. It can sever the spinal cord right through the back. If you can break through that bone and you're hitting high levels of your cervical spine. Basically, to die from a spinal cord injury from not breathing, it needs to be above the phrenic nerve. The phrenic nerve is 3, 4, and 5 of your cervical spine, all areas of that. So when it's above it, when you have what's called the hangman's fracture, right? So you get hung and you snap your neck, that's high up. So you basically stop breathing. You sever your ability to breathe, so you die. So same thing here, you're getting sliced in the neck, in the back, destroy the spinal cord, and then obviously straight through the airway in the front as well, because your structure right here. It's protected by your tracheal rings, but a sharp knife can get right through it. Obviously it missed the vessels that were on the side. So Lara Croft at least finally got this guy right into what looks to be the heart, and then she took an extra smack to get it right through. So again, you typically don't die that fast. I know it's a video game, but what ends up happening is you go through a few of the chambers of the heart, right? So you have your 2 atrium and your 2 ventricles. If you pop through the left ventricle, you're gonna die fast because that's where all your blood's pumping out of your heart. She's pretty close. Oh, got it. She's using her bow to strangulate. Yeah, you can strangulate somebody. Same with your arm or the bow, right? The mechanism of how you're killing somebody is you're decreasing their oxygen to their brain and then to their heart, and you're decreasing blood flow to their brain, which then will tell you, you're going to pass out, and then asphyxia to your brain as well. So very similar mechanisms dealing with oxygen, and that's how somebody dies when you get strangulated. Wow, super cool. Lara Croft can survive a ton of injuries. We unboxed a lot of different things. That was a lot of fun. Thank you so much for watching. Check out more videos on Gamology at YouTube as well as Facebook. We're gonna check out all the, gameplay from the Rise from, wow, Laura.
Okay, also, her name is Lara.
Lara, not Laura.